My name is Dr. Bryan Rade, and I am a naturopathic doctor, and this is a presentation about testing and treatment options for Lyme and co-infections. Quick note about who I am. I'm the owner of the East Coast Naturopathic Clinic in Bedford, Nova Scotia. I'm joined there by 3 fellow naturopathic doctors. I have 1 naturopathic resident, and we have 4 amazing support staff who really just run the show behind the scenes, and we couldn't function without. And to date, I've treated over 650 cases of persistent borreliosis, commonly known as chronic Lyme disease, and co-infections. And I've consulted on many others. I have local colleagues and colleagues from around North America who have reached out to me to ask for advice about these types of cases. And I also lecture at these topics at various conferences around North America, mostly in the States. And I've also recently started teaching a course about Lyme and co-infections at the Canadian College of Naturopathic Medicine in Toronto, which is where I did my naturopathic training. And to my understanding, that's the first healthcare institution of any type that has Lyme and co-infection training now a mandatory part of their curriculum. So that's a trend that I'm really hoping will catch on at other institutions, and it's one of my side projects trying to make that happen. There are 2 things that I was asked to discuss for this presentation, one being testing options and the other being naturopathic treatment options for quote-unquote chronic Lyme disease. I say quote-unquote chronic Lyme disease because in the scientific literature, the more politically correct term is persistent borreliosis, but of course colloquially we all, many people refer to it as chronic Lyme disease. So my thought was to present this information to you in a little bit more of a story form, and basically by presenting 4 case summaries to add a little bit more character to this type of content. When I thought about my Lyme practice and co-infection practice for this presentation, I really realized that I could fit most of my patients into one of 4 categories which are listed here. Of course, patients don't come in actually saying these things to me, but after I've done my assessment or after we've seen what kind of treatments wind up working for them, then essentially this is sort of what their cases say back to me. So we're going to go through all of these one by one in the ensuing slides. So the first case type is a patient who comes in, a case that basically says to me, I need antibiotics, but I can't get them. Of course, it's challenging to access antibiotic therapy for Lyme or co-infections in Nova Scotia, and unless patients can afford to travel to the States or travel to British Columbia, where my wonderful naturopathic colleagues there have prescribing privileges, then patients can sometimes be really out of luck. And so it's always disheartening when it seems like a simple course of antibiotics would do the trick for someone and they can't access it. Unfortunately, there are non-pharmaceutical options that can also work well, which I've seen many times in practice, and this case being one example of that. So this patient, when she came to see me for the first time, 25 years prior, she'd been diagnosed with fibromyalgia, and then 2 years before seeing me, she had a tick bite with a bullseye rash, which is 100% diagnostic for Lyme, but unfortunately she was told at the time that Lyme disease doesn't exist in Nova Scotia, which unfortunately was not accurate, but that's what she was told, and she didn't get tested for it or treated for it. She not only had a bullseye, which is maybe somewhat unsightly, but she also had lots of symptoms that came on as listed here. Some of the most notable ones being the severe migrating joint pain, and everything there is pretty awful. So even though she was told Lyme didn't exist, her healthcare providers, of course, tried to find out what was going on with her. So she had CT scans, CT scan and MRI, every blood test under the sun, and everything came back normal. A year later, so this is still a year before she came to see me, she did manage to finagle some doxycycline. She had 100 milligrams twice a day, which is, of course, a standard dose for acute Lyme. for more of a chronic picture, that would be, not necessarily a full dose, but despite either way, she felt amazing, as she said, and she felt amazing for 3 weeks until her prescription ran out, and then in, days afterwards, she started regressing and got right back to baseline, unfortunately. And more unfortunate than that, even though the therapy was working beautifully for her, she could not manage to get a refill, and she just went back to suffering for a year until she came to see me. So this is why I say this is really a case where the patient clearly needed antibiotics. She just needed a strong killing approach, and she just couldn't get it. So my thought with her case when she came to see me was, let's put you on the strongest antimicrobials that we have, and let's also, both in terms of an oral herbal formula, and then also the strongest intravenous treatment that we have for treating chronic infection, which is intravenous laser therapy. I unfortunately don't have time to get into the details of intravenous laser therapy, but the long and short of it is that we've tried many different IV therapies over the course of time for these types of patients, and the IV laser is hands down, in my experience, the absolute strongest one. And sort of as a case in point, she came in a week later after she'd had her first laser treatment, and she had a major Herx reaction. So Herx being a die-off reaction, we were killing infection too quickly. She felt pretty crummy for a couple of days afterwards. And this is a good sort of confirmation that these types of therapies certainly do kill microbes. They can kill them very aggressively, as evidenced by a Herx. It's, of course, common knowledge in this community that if the antibiotic dosage is too strong, then there'll be a Herx reaction. And so we see Herxes with herbs and intravenous treatments and different things like that on a regular basis as well. So I'm a self-professed anti-Herxer. I don't like seeing my patients suffering, of course, as nobody does, but I also think it's, in my experience, unnecessary to muscle through a Herx. So we just backed off on the dose. She started tolerating it just fine. And 1 month after that first visit, so she had about 3 laser treatments up to that point. She was working with the herbs, and she noticed significant improvement. Her eyes were only mildly burning. The numbness and tingling were gone. Her energy was up to a 7, where if 10 is perfect energy, she was up to a 7. Shoulder and elbow joints felt fine, but still had pain in her toes and her knees. Heart palpitations gone. So she's definitely still not 100% better, but she was so much better. So we kept up with the same protocol. And 1 month after that, she said, I'm really good. I have virtually no symptoms at all. So we kept up the protocol for a few more weeks just to make sure there weren't any straggler microbes kicking around. But then we backed off on the treatment. For the next year, she had a small flare every 3 to 6 months, so about 3 times over that year. She came in for a booster IV, put her on some herbs for a couple of weeks. Everything went back down to remission again. And she's been doing well for about 2.5 years to date now. So it seemed to be a long-standing recovery. So once again, this would be an example of we can, if needed, we can use these non-pharmaceutical treatments to exert a very strong killing effect in patients. The next type of case is a patient where they've been treated for Lyme and co-infections comprehensively, but they're still sick. They've in my practice, patients who come in, they've been on antibiotics and other pharmaceuticals for several months or 3 or 4 years, and they say, I'm still feeling pretty rough. I'm feeling maybe a little bit better, maybe 25% better, but I'm still pretty darn sick. And so we need to figure out, what else is going on? So this patient, this case being a good example of this, so this patient, 4 years before seeing me, she had this terrible bout of food poisoning, traveling someplace tropical. A month later, she had extreme bloating, she was exhausted, had severe insomnia, and she had arm and leg weakness to the point of needing a wheelchair, so really, really sick and debilitated. She also had a laundry list of other symptoms, a lot of neurological stuff, as is indicated here on the slide. And like the first case report, she had full gamut of diagnostic testing. Everything came back normal. I didn't mention blood work on here, but blood work being all normal as well. And she had consulted with multiple specialists, and the working diagnosis was MS, even though all of her MS tests were negative, but they just couldn't figure out what was going on with her. So I recommended that she run 2 tests, the first one being a test for something called small intestine bacterial overgrowth, which is this bacterial disorder in the intestinal tract, and the second one being this urine PCR test for Lyme and co-infections. PCR stands for polymerase chain reaction, and it's basically a DNA test. And so in the bold text there, it says if we find microbial DNA in the urine, then it suggests a current infection. Or as I like to put it, if we find microbial DNA in the urine, well, it's got to be coming from inside the body. And if the DNA is there, then those microbes are going to be there as well. So this Lyme and co-infection test, it takes about 4 or 5 weeks to get back. It's done by a lab called DNA Connections in Colorado, and so the bacterial overgrowth test only takes 1 week to get back. So a week later, went over the test results. She tested positive for this condition, so I recommended that she go on some herbs to treat this intestinal condition. So she came in about 5 weeks later to go over her DNA Connections test results, but in that time, she had noticed that she was having longer stretches of less bad days. So in other words, every day was a bad day, but some days were less bad than others, and so she found she was having more less bad days, which was a good sign. Her appetite normalized. On a previous slide, it said she was had ravenous hunger even though she was losing weight, so her appetite normalized, which was a good sign. She was probably absorbing some nutrients again. And then this internal tremor symptom that many of my patients with Lyme and some of my patients with something called mold illness experience, and that was reduced. So we're seeing some improvements even just by treating her gut. And so we went over the test results from the urine test, and sure enough, she tested positive for Bartonella henselae, which really fit her clinical picture the best out of any of the co-infections or Lyme itself. So I recommended that she keep up the bacterial overgrowth herbs, but also started an anti-Bartonella herbal formula. So this is a copy of the test results that we got back, and all of the microbes that are listed there are the various microbes that are tested for. So different species of Borrelia, Babesia, Bartonella, and then also Ehrlichia and Anaplasma. And so for whichever microbe comes up, there's a little check mark that pops up. So the little check mark to the left of Bartonella henselae, and then sometimes multiple species will come up, and many times we run this test and nothing comes up. So just there's a check mark beside the none. So 7 weeks later, she reported that the Bartonella herbs had caused an initial herx, and she had emailed me about that, and I had recommended that she cut the dose down to half, and so she was tolerating that. And she said, I think we're slowly moving in the right direction. She was able to go for short walks. Subtext being she was no longer stuck being in a wheelchair, so that's pretty great. Also, her neurological symptoms were much reduced to the point where at her first visit I asked her, what are the worst symptoms? And she said, basically, these crazy, scary, I don't know what's happening to me neurological symptoms are by far the worst. And pain and fatigue are up there, but neurological stuff is definitely the worst. Now she was saying that the neurological symptoms still there to some extent, but it was really the pain and the fatigue that were the hallmark symptoms. They were getting better as well, but it was quite telling that the neurological symptoms had improved so much, and once again, she was no longer in a wheelchair. Shortly after this visit, she managed to finagle a prescription for some doxycycline, only 100 milligrams once a day, which is quite a low dose, but she started on that. 6 weeks later, further improvements. So her cognition, stamina, etc. is indicated here. Things doing better. So definitely further improvement. Unfortunately, she still couldn't drive. Her sleep was still an issue. Her digestion had seemed to be doing quite well for a while. So we stopped the SIBO formula, this bacterial overgrowth formula, and she kept up the Bartonella herbs and the doxy. Now, a month later, nothing was really changing. Her energy wasn't really much better, and that was the main symptom that was holding her back. So she stopped the doxycycline. It was causing some gastrointestinal issues for her, it seemed, so put her on a probiotic. She stopped the doxy. She seemed to have plateaued there. During this time, we had also run some genetic test results, something called nutrigenomic testing. The results told us lots of things about her physiology, but one of the big take-home messages was that her body seemed to have a hard time making the active form of vitamin B12, which is called methylcobalamin. So I recommended that she start on that as a supplement. She came back in 1 month later, and energy was better. She could start exercising, but she found if she exercised for more than a few days, then she would crash for a few days afterwards. So her stamina or endurance was still quite impaired. She came in 2 months later, so still on the Bartonella herbs and the B12, and she was still doing quite well, but she felt like she had plateaued. So I asked her during the course of our visit, what's bothering you the most now? And she said that energy and endurance still not quite where she wanted it to be, but she said the main thing bothering her is that whenever she'd get stressed, she'd get these heart palpitations, a racing heart, she'd get itchy and get rashes, and so that can mean multiple things, but based on her history, I thought maybe you have a mold illness issue. Maybe there's been a mold colonization in your body, and that's causing some of these symptoms. And so I asked her the next logical question, which was, have you ever been exposed to mold? And lo and behold, she said, yes. I worked in this really moldy environment for years. While I worked there, I developed chronic sinus issues, which had never gone away. So it clinically suggested that maybe her sinuses had been colonized by mold. So I recommended that she do a lab test to look for presence of mold mycotoxins in her system, and we found lots of them. Her ochratoxin level was off the charts high. She tested positive for gliotoxin and mycophenolic acid as well as another one called citrinin. So we started a mold protocol, and 2 months later, her energy is much better. She's able to drive. She can exercise without crashing, and basically, sums it up there. I feel 90% better 90% of the time, so just a night and day difference. So it's still a little bit of work to do with her case, but she's pretty darn healthy now. So with this case, it's it's a case where she was treated for Lyme / a co-infection, Bartonella in this case, and she was doing better, but she was still having notable symptoms. And it wasn't until we figured out the mold aspect of her case that things really came together for her. So sometimes we have to look beyond the world of just Lyme and co-infections. The third case is a case of a patient who's been treated for Lyme and or co-infections and is doing markedly better, but is still not fully healed. It's those patients who I see who will say, I used to be, bedridden. I was, racked with pain. I could barely function. I could barely think, because my brain was so foggy and my memory was shot and all these things. And with treatment, I am at the point where I'm doing so much better. I can do things. I can live my life. I can go back to work, but I still get tired more easily than I used to. I still have, pain in my knees and my hips, but at least the rest of my joints are okay. So I'm doing so much better, but I'm still not fully healed. And so in that type of case, there are different reasons why. Maybe there's mold, maybe there's heavy metals, maybe there's biofilms, things like that. But it's ultimately something that we have to figure out what's still missing here. So this case is an example of that. This patient had been quite sick for about 7 years before seeing me. A couple of years prior to seeing me, he got hooked up with a Lyme literate clinician who diagnosed him with Lyme, Bartonella, and Babesia. He was treated comprehensively with antibiotics for 2 years, and then was doing so much better, but hit a plateau, weaned off, and then he had no relapse. So it really sounded like the microbes were probably under control. And so ultimately, he came in and said, my pain and fatigue are 80% better, my brain fog's 50% better, but I'm kind of plateaued here. So my advice was to run a panel through this lab called Armin Labs. Armin Labs is in a lab in Germany, and my thought was, well, let's just make sure that there's no evidence of residual Lyme or Borrelia, Bartonella, Babesia, or any other common co-infection, and then also to run a viral panel because he'd been treated comprehensively with pharmaceuticals, mostly antibiotics, some antiparasitics, but no antivirals. So I thought, well, maybe there's a virus. So we ran this panel, and Armin Labs runs various tests, but their claim to fame, so to speak, is something called an ELISpot test, which is an enzyme-linked immunospot test. And as it says here on the slide, it looks for what's called a T-cell response to a microbe, which indicates a current infection. So a Western blot or an ELISA test is an antibody-based test. And antibodies, especially with respect to Lyme, can sometimes linger for years and years and years after the microbe is potentially long gone from the body. So if you have a positive antibody response, it tells us that you've been exposed to that microbe, but it doesn't mean that it's making you sick, and it doesn't mean it's still in your body now. Whereas a T-cell response is a different type of white blood cell. And T cells only have a lifespan of about 7 weeks, meaning that if we run a blood test and we see that there's a T cell response to a microbe, it means that that microbe was in your body sometime within the last 7 weeks. So in other words, it's for all intents and purposes telling us, is there an infection right now, or within the last 2 months or so. So with this particular patient, I recommended he run this panel, and everything came back negative. So it looked like he probably didn't have a lingering infection or a viral reactivation, which was a good thing for him. This is a sample report from Armin Labs. This is not this patient's set of test results. This is somebody else. This is actually a positive result. And basically, if any of the numbers in the right-hand column are higher than a 1, that's considered positive. Anything higher than a 3 is considered to be more strongly positive. So this particular patient tested, the one from these test results, tested positive for Borrelia. Also tested positive for cytomegalovirus, and then had elevated antibody titers against the HHV6 co-infection virus. So given that it looked like the patient truly was, as best we could tell, likely free of infection, I recommended that he run something called an organic acids panel to test his mitochondrial function. Mitochondria are the little energy factories in the cells, and so what happens if your cells don't make enough energy, or your body can't heal very quickly, maybe can't heal fully, and you also feel unwell, because if your cells don't have enough energy, then, well, you're not going to feel like you have enough energy. Your brain's not going to feel like it has enough energy, so you're going to feel tired, foggy, and it can certainly precipitate or exaggerate pain as well. And so these test results indicate some mitochondrial dysfunction, and I mostly just put them here because they're a pretty picture. We don't have time to go through them. And some other markers of mitochondrial function as well as antioxidant status. So the test results indicated that his mitochondria looked like they were not doing optimally well. So I recommended that he start on a comprehensive mitochondrial support formula, or protocol rather, which involved taking 2 oral supplements. And I recommended he add in an extra antioxidant called glutathione to help with his brain health, because the brain fog was the more challenging symptom to treat up to that point. So 6 weeks later, he said, my pain is gone. What was also interesting is he said, my massage therapist, just every time I go in, would say your muscles are just, rock solid. They just, no matter how much he stretched and all that, his muscles were so tight, and his muscles were no longer tight. And that makes sense, because if the muscles don't have enough cellular energy, they can't actually fully properly relax. His energy was 90 to 100% better depending on the day, whereas before seeing me it was at about 80%, and then his brain fog was about 70% better, whereas it was 50% when he first came in. And then sometimes he'd say, I have glimpses where I feel like I'm 90%. And 2 months after that, so 3.5 months after seeing me, he said, I feel like my old self the vast majority of the time. Brain fog is about 90% resolved. So in this case, it really looked like, the work that he had done with the previous clinician had served him very well. Likely got, seemed to get all the infection out of his system, but his body was still needed healing support. It needed support recovering, and maybe it would have got there on its own after, another 1 to 5 years, but he didn't want to wait that long, and so thankfully he had good results quite quickly. The final case type is the patient who comes in and it really sounds like it's, Lyme or a co-infection, but it turns out that it's something else. So a case of, I don't actually have Lyme, but it sounds like I might. So this patient, when she saw me, she said, I've had, fatigue for 8 years. I have this migrating pain from going from joint to joint for about 5 years, a lot of brain fog, spasms and calves in her feet for the last 5 years. She'd had lots of lab tests and imaging tests like everybody gets done in this patient population, it seems, and everything was normal. So just looking at these details, it would be very reasonable to think maybe you've got Lyme or a co-infection, because this looks like textbook symptoms for that type of scenario. However, the one other symptom, or the two other symptoms she mentioned, was that she'd had heartburn and severe bloating for 10 years. And so I looked at the timeline and thought, well, you've been having severe digestive issues for 10 years. 2 years later, you get this fatigue. 3 years after that, you get all this pain and muscle spasms and whatnot. So it might be that you've got Lyme or co-infections, but it also might be that you had some digestive issue, which led to severe nutrient malabsorption, which if you don't absorb your nutrients, you don't make energy, so you feel tired. And eventually, if you don't absorb enough nutrients and your cells can't produce enough energy, then your muscles get tight and you get more inflammation and you start getting a lot of pain and whatnot. And so I recommended that she get tested for this small intestine bacterial overgrowth condition, which we discussed previously. Her results were positive, and I recommended that she start on some appropriate herbs to kill the overgrowing microbes and go on a low complex carb diet, which is the diet of choice to starve out these bacteria. And 6 weeks later, she said, I feel a big difference overall. Digestive issues, pain, energy, everything doing better. She was about 100 pounds overweight at baseline. She lost 25 pounds in that 6 weeks. Mostly seemed to be water weight or inflammation weight because she was urinating like crazy for the first 2 weeks. And I recommended, where she was doing so much better, she continued the protocol. So 6 weeks after that, she was doing even better. Energy almost perfect. Digestion's perfect as long as she's eating on the, staying on the diet. Joint pain down to a minimum. So I recommended she wean off the killing aspect of things and go on a gut healing protocol. And 2 months after doing that, she was virtually asymptomatic, and ultimately just showed that it was a gut issue. It was not Lyme or co-infections, because if it was, she wouldn't have likely responded to this treatment in this way, because the herbs that get rid of the gut bacteria are totally different than the ones that get rid of Lyme. So the question in this case would be, well, how do we know when it's actually not Lyme? And it really just comes down to clinical experience. After seeing hundreds of cases like this, there's just certain patterns and things to look for to see, maybe it's not Lyme. Many times it is Lyme or co-infections in my experience, but I've had dozens of cases like this one where on paper it's like, of course you're coming in to see me because you think you might have Lyme or co-infections, or of course your other clinicians have treated you for those conditions because it made all the sense in the world. But just hearing the right details or asking the right questions, and sometimes we find it's something else, or it's Lyme and co-infections in addition to something else, like some of the other cases. So I hope this presentation was beneficial. If you would like to contact my clinic for any reason, this is our contact information, and thank you for your attention.